Let's talk EMT, tactical, and even military. VRpatients has a new feature called spatial pass-through. This allows you to populate an avatar on the cot anywhere you're standing. So you can be outside, inside, in the grass, in an alley, in a helicopter, in an ambulance, in an apartment, in the battlefield. And you can actually integrate physical skills with these unique specialty items that you might see in the military or SWAT or EMS and paramedic. So for example, I might have a patient on the cot and they're insanguinating, they're bleeding, and their blood pressure's dropping. And what do I need to do? I need to apply a tourniquet. I need to administer TXA. I need to get their fluids rolling, and we need to roll. This patient's in an emergency. Now, all of those clinical decisions, what dose, what route, how much TXA am I giving, did I assess the patient appropriately, listening to their lung sounds, do they need a needle decompression, like all of those things are super important to stop the bleed, get the patient stabilized, and get them transported. But there is just so many physical resources and psychomotor skills that I need to do. I need to crank down with my hands on a tourniquet and put 2 on. I need to needle decompress with a 14 gauge into the side of this like barrel-chested task trainer. I need to grab my bag, throw it down, zip it open, pull it out, and whip and pull up my medications. I need to practice doing those things in real life because we are 50% as accurate in an emergency. So you have to practice those things in real life. You cannot just practice those things with controllers or even hand tracking because I'm not actually learning the skill. I'm going to have to practice that again. And with VRpatients' spatial pass-through, I can make my clinical decisions and then turn without having to take off my headset and suddenly grab all of these physical objects and work on them and do them on task trainers. Turn back to my simulation and continue my treatment. And then I can get quizzed. In sim, a SimTech voice can pop in and start to ask me questions about, what did you do? Why did you do that? And you're answering multiple choice, which allows the proctors to document what they did in the sim and what they did in real life. And of course, all of this can be casted for the group or recorded directly to the headset. We really can innovate with EMT, tactical, military, SWAT, government, and do something that's never been done before for public health.